Policymakers fighting poverty face a persistent trade-off. They can spend money today to alleviate immediate starvation, or they can invest in education and health to build human capital for tomorrow. Conditional cash transfers attempt to do both. Governments give direct cash stipends to poor households, but strictly require that those families keep their children in school and attend regular medical checkups. The global pioneer of this model was Mexico's 1997 Progresa program. It targeted low-income, rural communities with strict means testing. Early randomized evaluations tracking the initial participants showed immediate success. Children enrolled in the program attended classes at higher rates than those in control groups. Knowing if those children actually escaped poverty requires checking their financial status in adulthood. We have to look 20 years down the line to see if the intervention broke the intergenerational cycle. Following the original 1997 experimental cohort into adulthood hit a severe methodological roadblock. The data simply vanished. Tracking specific individuals across decades requires stable populations, which is nearly impossible in rural economies characterized by heavy labor migration. By the time the children in the initial 506 study communities reached their 20s, researchers had lost track of over 99. Because Progresa was strictly means-tested, administrators rolled the program out to the absolute poorest municipalities first, before expanding to slightly wealthier regions. Comparing a chronically poor early adoption region to a wealthier late adoption region would bias the results. To fix this, Parker and Vogl restricted their entire dataset exclusively to areas classified as high and very high marginality. Within this narrow band of severe poverty, they established a temporal comparison. Instead of comparing treated areas to completely untreated areas, they compared early adopters to late adopters. The early adopters are defined as municipalities that enrolled between 1997 and 1999 under the Zedillo administration. The late adopters are municipalities that enrolled later, between 2000 and 2005 under the Fox administration. To ensure an exact match, the model only compares early and late municipalities that ultimately achieved the exact same cumulative enrollment ratio by the year 2005. By locking down these parameters, the researchers isolated the exact timing of the cash transfers from the underlying wealth of the region. The second variable required to build the control group is cohort age. Progresa structured its cash grants to prevent dropout at the most vulnerable point in the Mexican education system, the transition between primary and secondary school, usually occurring between 6th and 7th grade. This chart illustrates 1990s Mexican school enrollment, showing a steep drop-off at ages 12 to 14. Children 13 and younger form the fully exposed cohort, incentivized to cross the primary to secondary threshold. Teenagers 16 and older are the unexposed cohort, having already missed the transition window. This strict age eligibility creates a natural dividing line within the exact same municipalities. This difference in differences matrix merges both variables. The x-axis plots the spatial rollout, early versus late, and the y-axis plots exposed versus unexposed cohorts. The unexposed teenagers establish the baseline for the local economy. The fully exposed children in early rollout municipalities form the true treatment group. By measuring the gap between these specific quadrants, the matrix mathematically isolates the exact impact of childhood exposure to Progresa, filtering out any other macroeconomic shocks occurring in Mexico over the 20-year gap. Running the 2010 census data through this matrix reveals distinct outcomes based on gender, starting with women. This event study line graph charts female educational attainment. Across the older, unexposed brackets on the right, the trend line is entirely flat, proving parallel pre-trends before cash transfers arrived. Moving left to the 9 to 13-year-old cohorts, the data registers a sharp upward spike in attainment. Childhood exposure to Progresa resulted in 1 to 1.6 additional grades of completed schooling for women. In adulthood, this exposure drove a 5 to 9% increase in female labor force participation. Once in the workforce, these exposed women experienced a 40% increase in adult labor earnings. The data establishes a direct causal link. For women, childhood conditional cash transfers generated a permanent positive shift in their adult economic trajectory. The male data presents a distinct analytical paradox. This side-by-side comparison displays the clear upward trend for women on the left, next to the male event study graph on the right, which registers as a noisy, flat, and statistically insignificant scatter of data points. The measured economic results for men are nearly indistinguishable from general spatial convergence between poor and wealthy municipalities. This result is heavily obscured by selection bias. The 2010 census regression sample contains a demographic anomaly. There are 16% fewer men than women in the studied age cohorts. The primary driver of this missing male population is an extraordinarily high rate of unobserved international emigration to the United States. The secondary driver is a severe surge in young male homicide mortality in Mexico, beginning in 2006. The men with the highest potential to benefit from education subsidies, those who are highly capable, mobile, or risk-tolerant, are exactly the demographic most likely to migrate or be killed. Their removal from the census dataset heavily downward biases the results, making the male failure inconclusive. A rigorous cost-benefit analysis of Progresa requires isolating the math solely to the verified female outcomes. We calculate the return on investment under the conservative assumption that the program had exactly zero long-term economic impact on men. This visualization weighs the total early rollout costs against the 26.4 billion pesos in projected lifetime earnings generated exclusively by the exposed women. Even applying a strict upper bound estimate for public funds, female returns alone yield a benefit-to-cost ratio between 1.5 and 2.0. Despite the noise of migration and attrition, Parker and Vogel's methodology proves that targeted childhood interventions demonstrably break the intergenerational poverty trap, operating here as a highly cost-effective